Namaste and good afternoon. Greetings from all of us at Apollo Hospitals. Welcome to our Facebook live session. This is Dr. Srinidhi Chidambaram, and I hope you're all staying safe and well and keeping great health. We have been, as you know, presenting Facebook live sessions on key topics that each one of you should be aware of because knowledge is the very first step and is key to early recognition of diseases. And it is even more critical that we prevent diseases before they take hold, and this can only be done by consistently following a healthy lifestyle. Our habits and our lifestyle and what we do every day make us what we are. Diet and weight management is one of the most important pillars of a healthy lifestyle. And today, nobody needs to be told because diets and losing weight are the hottest topics in all conversations these days. Have you lost so much weight? How have you done it? What is the most effective diet? Should I do keto? Should I do fasting? It looks like, this buzz is never ending. But did you know that as many as two-thirds of people who go on crash diets end up actually heavier and being less healthy than when they started? So, this is actually because people normally want a very quick fix, short term weight loss plan, and they don't understand that healthy eating is really a lifelong commitment to your health. And nutrition is something very different from a diet to lose weight, and fads and quick diet prescriptions abound all around us, but you must know that they most often fail. Yet, we don't quite get it, and we keep hankering for that magic solution which will cause that overnight weight loss. So, today we're going to address this very interesting and important topic: why do diets fail? And what are the biggest nutrition and diet mistakes that we make? And also, of course, what strategies would help us in reaching our ideal state of good health? These questions are already in your minds, so let's find the answer today. And I'm delighted to welcome Dr. D K Daphnee, who is the Chief Dietitian and Head of the Department of Dietetics, Apollo Hospitals, Greaves Road, Chennai. Dr. Daphnee is an MSc, PhD, and a PDCR uh, qualified nutritionist. And her area of research in her PhD was the analysis of nutritional deficits in Indian adult patients with end stage liver disease and the influence of nutritional support on peri and post liver transplant outcomes. She completed her MSc from the Women's Christian College, Chennai, and has had over 24 years of work experience, clinical experience at Apollo Hospitals. She's the course director for the Apollo Clinical Nutrition and Dietetics Internship Program at Apollo Hospitals, Chennai, and member of Board of Studies, University of Madras. She's a member of several professional societies, such as the member of the Indian Dietetic Association, the American and European Societies of Parenteral and Enteral Nutrition, and many more. Received numerous awards as well. The CMO Asia Award 2017, the Apollo Clinical Excellence Award 2018, and so on, and is also the reviewer of several journals and has had quite a few national and international publications. Dr. Daphnee, welcome to this session, and thank you so much for joining us. Let's begin by...
Namaste, Dr. Srinidhi. It's indeed my pleasure to be with you.
Yes, thank you. So let's begin by asking you the basic question. Why do diets fail?
I'm really glad to talk about this topic. In the past 2 years, rather post-pandemic, you see a lot of awareness of nutrition. But as the awareness keep increasing, we do find a lot of mistakes also keep increasing. The common mistakes which lead to failure of diets. I'll just name a few common things like, a very low fat diet or a crash diet. I don't know why people rely on it, but it really fails. Next, nutrient-wise, if you see a very low-fat diet or a very low-carb diet, completely devoid of carbs, how long you're able to follow is a question mark. Third, inappropriate protein intake or not enough protein intake is one more thing that people fail on or people don't think about when they diet. Next, setting unrealistic goals. As you gave an intro about crash diets, people want it so fast. Unrealistic goals are set, so which make them feel they've failed. Then it could be, not adequate fiber in the diet. We don't really concentrate on vegetables and fruits. So not enough fiber can also be one of the reasons why they fail. And they are not consistent. You cannot do yo-yo dieting because follow some certain diet for 10 days, then give a break for 2 weeks. That doesn't help us at all. These are some of the common mistakes what people do. And beyond that, one more important thing that I would like to discuss in this next half an hour is about the timing that we fail to understand. Timing of the diet, frequency of the diet, that also plays a vital role, which generally, people miss out when they diet.
Right. So we were talking about crash diets, and we now know that they are not healthy, they are not sustainable. But what are the common harmful effects of going on crash diets?
When we talk about crash diet is nothing but very low fat or very low calorie, VLCD diets. And many a times people do it looking at Google, not under proper supervision. That could be one of the important factor which makes them fail. It has to be under supervision of a doctor and a nutritionist. And it gives you very low calories, less than 800. So when we talk about, thinking about the overall nutrient content of such a diet, there will be lacunae. So nutrient deficiency can be common. And when we are restricting on fats, there is restriction on protein also because animal fats are restricted. So protein intake goes down and carbohydrate intake goes high. So it becomes a little difficult. And when or the other way, when we talk, if you increase too much of protein also, that can lead to, kidney problems. These are all common issues that people face when they go into crash diet.
Sure. Another thing which people, because now there is a real confusion because we do talk about intermittent fasting diets where, one says skip breakfast and you eat only by around 12. At the same time, there is also this saying that, you should not skip breakfast. So this is something that even I have been meaning to ask you. So what is the right thing to do?
It is two contradictory, statements, right? Intermittent fasting, people do follow for weight loss. But on the other hand, if you are skipping your breakfast, you do have a lot of health issues that can be tagged along because breaking the fast in the morning is so vital. There are a lot of, studies going on with regard to chrononutrition. Chrononutrition is nothing but the science that relates to circadian rhythm of our body. So if you're going to skip your breakfast, it is going to have a negative impact on our system. It can impact our metabolism. It can impact our hormones, neuroendocrine hormones, which really has an impact on the NCDs because insulin sensitivity or the resistance becomes higher. Sensitivity comes down and people can become more obese and their lipid profile gets affected. We do find the waist circumference increasing if we are restricting or avoiding breakfast. Same way, triglycerides, we do have studies which speak that more than 30% increase in triglycerides if they break or if they skip the breakfast. So it is so important that we have a healthy breakfast in the start of the day. And it should be very important that we stick on to the timing. We cannot have our breaking the fast by 12 noon or 1 o'clock. It is not breakfast at all. So it has to be in the morning by around 8 to 9. That is a usual simple way of doing things, because we are genetically prone, or we are customized to certain things. And breaking the fast in the morning has beneficial effects, and ill effects, if you don't have, also keeps on increasing. That's because if you don't break your fast on time, what happens is your satiety score increases. You tend to feel very hungry throughout the day because you're not feeling full at all. You tend to overeat in the future 2 meals that you're going to have, your lunch and dinner. That way, the overall calorie count also can increase, which can lead to the other NCDs, or it puts you at risk of developing diabetes, stroke, and cardiovascular diseases.
This also brings me to another recent phenomenon of avoiding dairy. So there is this whole movement of veganism, and people often substitute milk. Many times we hear the doctors also telling patients to avoid dairy. I mean, so who has to avoid dairy, and does it interfere with weight loss?
So this is a very interesting question, because many a times you do find teenagers totally avoiding dairy products. That is related to acne. Many dermatologists also tell them to avoid. When we talk about dairy products, you have to segregate it as low fat and high fat. When we talk about high fat dairy products, it has a direct correlation with the inflammation, so leading to acne. So whenever we speak about dairy products, always try to choose low-fat dairy products. Anything between less than 3% or even 2% fat milk is more safer compared to a 6% whole-fat milk. So there should be some discrimination there. And one more important thing is that not all of us have the same impact. Every individual's metabolism is different. So it cannot be generalized, saying that all of us who wants to reduce weight have to be on a dairy-free diet. Not necessary at all. There are patients who are allergic to milk, like either lactose intolerance, or there are patients who have bloating, indigestion because of milk intake. Such people who have a slightest allergy towards milk can be totally devoid. They can have diets totally devoid of dairy products, but it does not apply to all the general, normal healthy individuals. So it has to be individualized, looking at their history and their overall comorbid conditions. We should decide. It cannot be one for all.
Yeah. The other thing is really about sugar. Now, we all know that sugar is harmful, white sugar, but then there are many myths surrounding sugar, as in you can eat jaggery, or there are other forms of sugar. How much of sugar can one really have, or is it something which is best avoided?
Whenever we talk about weight loss, and if the percentage of weight loss is quite high, say, for example, a person with a BMI of 30 plus, then I would say a zero sugar diet is better, because the amount of weight reduction required is higher. If a person is slightly overweight, maybe 1 or 2 teaspoons of sugar throughout the day should be perfectly fine. As per NIN, a healthy person can have 5 portions of sugar, which is 5 grams each. So altogether, it's about 25 grams. So sugar perspective, whether it is simple sugar or jaggery or palm sugar, whatever be it, all put together, or it is a sweet that you're having, everything should be counted. The simple sugars which are added throughout cannot exceed 5 teaspoons for a healthy person. For a person who is wanting to reduce weight, I would advocate 0 to 2 teaspoons of sugar.
Right. You mentioned about protein intake, and in our South Indian diet, I think there's one thing that it is largely rice based, and though there are proteins, I don't think the quantity is really that much in our daily diet. But at the same time, you said that proteins are very important for a balanced diet. So, how much of protein and where are the sources of protein that one could have in an Indian diet?
The requirement of protein for Indians, if you take, it's about 0.8 to 1 gram per day, per kg body weight per day. So if I am around 60 kg, I require about 60 grams of protein. And in specific, when we talk about Indian diet, it is predominantly a vegetarian diet. And one of the surveys, Prodigy survey, has clearly narrated that 9 out of 10 Indians have inadequate protein. Say, for example, if I have to talk from my experience, from patients, you see that majority of them eat very poor protein. And especially when we look at vegetarians, it doesn't work around, it doesn't cross even 30 to 40 gram of protein per day, whereas their requirement may be 60 to 80 grams. So this is very common among Indians. And whenever we talk about weight loss setting, the increased intake of protein is important for us to compensate the carbohydrate that we reduce and to preserve the muscles that should not be wasted. So at least 1.2 grams of protein per kg body weight, ideal body weight, is advocated. So overall, if you look at it, it's about 20 to 30% increase of protein, which has to be followed when we talk about weight loss or weight management. So from what source we can get when we talk about vegetarian protein, it is basically dal protein, milk protein. These are the two sources from which we can get protein, and non-vegetarian sources being eggs, chicken, fish, and red meat. Red meat is the least because it adds on your cholesterol also. So chicken or fish on a regular basis is perfectly okay. And eggs, when you talk, it is a combination of fat and protein. So fat perspective, the yolk can be restricted to 1 or 2 per day, not more than that, depending on your requirement. And anything beyond 1, it should be egg whites only. So these are the components which has to be incorporated in every day's meal or every meal. Your plate should have a component of protein. Otherwise, we may not be able to achieve the increased requirement of protein when we talk about weight management or weight loss program.
Also, there is this current trend, for having protein shakes or added protein powders. There are a lot of vegan proteins as well. So, is that something that is advisable for everyone, or who would need that sort of thing? Because we find a plethora of such options now in the market.
Exactly. There is umpteen number of protein powders available in the market. And especially this is advocated whenever we talk about the VLCD diets, wherein these components, when they are added, at least it takes care of the other nutrients like vitamins and minerals, which is balanced in such powders. So it has to be taken under medical supervision only. It has to be a nutritionist or a doctor who prescribes that. It cannot be that you can just Google out and you find something very interesting, you go with it. No, it has to be matched with your requirement, and it has to be, planned accordingly. Either it is given as a mid snack or as a meal replacer totally. So this normally we give it when the normal diet that we prescribe for weight loss, the low carbohydrate or a high protein diet, which does not work after a period of time, then we think of meal replacement, or there are patients whose comorbid conditions way higher. So it is so important for us to start on a meal replacer at the earliest to bring down their risk of other comorbidities.
Okay. The other aspect you were also mentioning is fiber. So this is something which I think a lot of people miss out. So what are the sources of fiber and how much should one have in a day?
Fiber is a very important component of the diet, which is undigested. It is part of the carbohydrate. It's a plant-based source. That's why we talk more about vegetables and fruits. And there are two types of fibers. One is soluble, one is insoluble. Soluble fibers, we get it from peas, beans, oats, apple, and this supports in maintaining the blood sugar. And insoluble fiber, you get it from the bran that we eat. The whole grains are advocated for their brans. So whole grains give you, whole pulses give you insoluble fiber, and a lot of vegetables like green leafy vegetables and fruits with skin provide insoluble fiber. These are also undigested in the system, and it has an impact to increase the bulk of the stools. So this will help the gut to be happy. Keeping the gut happy gives you a better improvement in the overall immunity. And high fiber diet helps us to get relieved of constipation, and it reduces the risk of cancer, heart disease. It helps to maintain blood sugar, blood cholesterol. You have a long list of benefits if you have adequate amount of fiber. The quantity recommended is 25 to 30 grams per day. And the components that I discussed, whole grains, whole pulses, vegetables and fruits. Vegetables and fruits are very important. At least 5 cups a day is advocated. And whenever we talk about weight loss, it can be increased to 6 to 10 cups also, because when we restrict on the carbohydrates, we need to replace it with these fibers so that our satiety is much better. People are able to continue or consistently follow the diet to have a better outcome.
Another commonly asked question is, again, there are two different theories. One is that, you eat every 2 hours, small, frequent meals, but there's also this other thing that you don't eat like that. You eat only when you're hungry, or rather you only eat like 2 meals a day and things like that. So what is your take on that? What should, or is it different for different people?
It is two different concepts. And both the concepts, there are researchers to prove that it is right. But you need to be a little more practical. Say, for example, only when you're hungry, you eat. So it has an impact on maintaining blood sugar. That's what some of the researchers say. But if you're eating only 3 meals, what happens is people tend to feel a little hungry. Say, for example, an obese diabetic. If he is left to eat in the morning by 8 to 9 and his lunch is between 11 to 1 to 2, so 4 to 5 hours of break in between, many of the diabetics will not be able to sustain it. They will feel very hungry. The tendency will become high for them to overeat in the lunchtime, that their sugars can shoot very high. So normally, in practice, when you say, even the American Diabetic Association clearly mentions 3 main meals with 2 snacks. So splitting it throughout helps us to maintain the blood sugar in a better way. So the snack that you eat, this is where people go wrong. You have to make sure they pick up the healthy snacks like nuts or some fruits in between, instead of sipping through a high-calorie liquid or having some junk food in between, which can be calorie dense. So what is the culprit? It is the wrong choice of the snack which is the culprit, and not the snack by itself.
Right. And now let's talk a little bit about some of the names that we often keep hearing about. So one such is the keto diet. What is that, and what are its? I mean, what do you think about it? Is it harmful?
Keto diet perspective, they zero down on the carbohydrate, they increase on the fat, and moderate protein is provided. So, how long a person will be able to sustain such a diet is always been a question. There are people who sustain it for some time, as you discussed, like a crash diet. I want to reduce my weight for a particular reason. I do it, I stop it, then I gain weight. Do you think it is a right way to do such a diet? No, it's not. See, dieting perspective, it's a lifestyle modification. You should not be compromising on any of the nutrients that's required for our system. It is so important that we balance everything. So when we talk about keto, it is predominantly 70 to 75% of the energy comes from the fat, hardly 10% from the carbohydrates, and another 10% from protein. So if you are not planning your keto diet properly, you might be devoid of protein also. Say, for example, in a vegetarian keto diet, will they get adequate protein as in a non-vegetarian keto diet? Absolutely not possible. That is when they look at, replacing it with powders, protein shakes in between in order to get the protein in the diet. So how far it is feasible to do it on a regular basis also becomes a big challenging question. So, over a period of time that we will have researchers to prove things are right, things are wrong. There are researchers which say that these diets can lead to nutritional deficiencies and some of it leading to kidney problems also. So it is always safe when you do a diet, do it under the supervision of a medical team.
Similarly, another popular one is the intermittent fasting, where now people follow all sorts of 8-16 and different methods. Is there a benefit actually in fasting like that?
There are bit of benefits which are proven by research. Say, for example, it helps to reduce blood sugar, but how well they're able to adapt the 16-8 pattern is a big question. See, eating for 8 hours, whenever we talk about intermittent fasting, it does not speak about the nutrient component or the food component. It only talks about the window period. So whatever you want, you eat between 8 hours and fast for 16 hours. It really has an illogical effect. Though they claim there is, impact on diabetic control, if you follow the diabetic diet only, it has an impact. That's what we discuss with our diabetologists. So they also advise the window period can be shorter, but it cannot be left to them for them to decide what they want. The nutritionists have to decide as to what they can eat during that window period to control the diabetic. They cannot be left open to eat in the night. Many times in Indian setting, what happens? People, eat late. That is a very wrong habit. Even in chrononutrition, if you see, the frequency of eating and the timing of eating is so important. In intermittent, also the timing is important. Say, for example, 8 hours. If in case people are not able to adapt that 8 hours, what in practice I would advocate is 10 to 12 hours of eating. And night, you stop eating by 8 o'clock or maximum 9 o'clock. Do not eat by 10, 11, 12. This is pretty common among youngsters. And young people at that age, they may not get any major disease. Maybe a decade later, they might be at risk of diabetes and heart disease, because eating late in the night leads to obesity, leading to other non-communicable diseases like diabetes. So what I would like to advocate with regard to ketogenic diet is, intermittent fasting is The window period can be relaxed so that you can continue doing it consistently. Inconsistent way of practicing any of these diets will not help.
We also often read that, the Mediterranean diet and the paleo diet, these are all the healthiest diets. In the Indian context, what would you like to say about that? Or do you think we need to adapt some of those
The
principles?
best diet that is advocated is Mediterranean diet, because it advocates low fat, good increase in the fiber, that is vegetables and fruits, adequate amount of protein from simple lean meat and fish. They encourage at least 2 to 3 days of fish in the diet. And this diet has been proven to have a good impact in decreasing inflammation and non-communicable diseases. In our Indian setting, if you take, our Indian food is a healthy, balanced food. If we eat it appropriately, the way our elders or our, elders at home usually have. Our pattern of eating is basic carbohydrate from either rice or roti with a dal and at least 1 to 2 cups of vegetable and curds. This is the basic meal that we normally eat, wherein we do incorporate basic carbohydrate, protein, fat, and the vitamins and minerals which you get from the vegetables. So balancing it is so important. Apart from balancing the food that we eat, if we stick on to the timely meals throughout the day, starting from breakfast, ending your dinner a little early by 8 o'clock, will make a very healthy pattern, which will help you to restrict or reduce the risk of non-communicable diseases.
So the final question is also that, there is this, when you are following a weight loss diet, to what extent should exercising be done? And sometimes, the very low calorie diets or low carbohydrate diets do not allow, people to actually exercise. And it is often said that, no, the diet is more important. So how do you derive that balance between having the energy to exercise and also cutting the calories?
It is so important that we first set the goal. This is where people go wrong. They do start at a higher, expectation, and start out with increased hours of exercise. See, all those, if they start so much, they may not be able to continue consistently. So always set a goal of only 5% of your weight to be reduced. Take time to lose weight. It should not be done in a crash way. Crash dieting is not advocated. Have a balance between your diet and your exercise. A minimum of 45 minutes of exercise every day to a maximum of 1 hour is more than suffice, and it has to be at least 5 days a week, which is a mandate. When we talk about diet alongside, both together has a very good impact, and so many researches have been done, looking at only diet, only exercise, and diet and exercise, wherein we find a good result only with diet and exercise, and it has to be consistently done in order to reach the goal. And once you reach your goal, it does not let you to get back to your old style. You have to be consistent, and it is a lifestyle change which is expected. And when we talk about diet, to give you the energy to do the exercise, that is why we don't advocate a very low calorie diet. The calorie has to be adequate, but from where the calorie comes in is the question. Are we getting it from the right source? Are we restricting an amount of carbohydrate? Are we giving adequate fat? Fat per se, is it the good fat or the bad fat what you take? Normally, when we talk about high fat diets, it's the junk which provides you the fat. So it's a bad fat. So whenever we talk as nutritionists, it is the good fat which has to be incorporated. That is from the sources like nuts, fish oil. All these are sources which can give you energy. And it is not that you have to be totally devoid of oil. You can incorporate at least 5 to 6 teaspoons of oil in your diet so that you get your energy. In the meantime, you'll have to restrict your carbohydrates. Do not overboard on carbohydrates. It has to be less, around 50% from carbohydrates. So carbohydrates quantity has to be restricted so that if all these are balanced properly, you will have adequate energy to do your physical activity simultaneously along with your diet. So you have a better outcome.
All right. So thank you so much, Dr. Daphnee, for this wonderful discussion. Viewers, I do hope you enjoyed this session. To improve our health, lose weight, and keep it off, we have to make these real, sustainable, long-term changes to our lifestyle. Now, this may not seem a very exciting thing to do, but that's really the only thing that works. Since we are all still tempted by the lure of crash diets and quick fixes, it's very important to learn that any weight that you have gained did not come overnight. So it will not go overnight either. There are very few people who will, like generally the buzz and the trend is always towards quick fixes and magic, exciting diets, but they don't really work. So there are really no shortcuts. And long-term health is really related to a lot of lifestyle changes and consistent, balanced diet and consistent exercise as well. So for any further clarifications, you know that you can reach out to us anytime on all our social media channels, on our app, and on our website. So do contact us if you need any assistance. We're always here to support and help you. Until we meet again, stay safe, stay healthy. Thank you, and namaste.